Hello, my name is Angelique Harrod. I'm a student with the Respiratory Care Program at Baptist College of Health Sciences. Today I'm going to instruct you on how to perform an anterior blood gas. So when you initially come into the patient's room, you need to identify yourself. Hello, my name is Angelique Harrod. I'm a student of Respiratory Care. I'm here to get some blood from you. If I can get your name and date of birth, please. So I would look at his wristband or her wristband to get my patient identifiers. And also you need to review your physician order to make sure that an ABG is ordered. You want to also go through the patient's history to make sure they're not on any anticoagulant therapy, because that could be a contraindication. You would also need to speak to their nurse just to let them know that you are drawing some blood. So you also want to perform ADA. You want to explain to the patient what you're going to be doing, how long it would take, just kind of walk them through the whole process. For the equipment that you need for an anterior blood gas, you need your ABG kit. In your ABG kit, you have your biohazard bag, you have a bandage, alcohol, patient label, gauze, your heparinized syringe, and you also need some clean gloves. So first you want to do is you want to assess your patient. So you would look to see my patient is currently on a binasal cannula at 3 liters. SpO2 is, he's setting 88%. His heart rate is 110. His blood pressure is 156/98, and he is breathing about 30 times a minute. So first you want to perform hand hygiene and put on your clean gloves. Make sure all of your equipment is ready to go. You want to make sure you expel your heparin, which you can do in your package. I have my alcohol ready. And my bandage. Gauze. Before performing your arterial blood gas, you need to perform the modified Allen's test. So you want to ask your patient to close their hand, palpate their ulnar and their radial artery, and as they release their hand, you release the ulnar. You want to check for collateral circulation, so you should see color return back within 3 seconds. So he had a positive modified Allen's test, so we can begin with the puncture. So after I've palpated and I have a good pulse, I want to clean the site. And make sure you have the arm positioned so that you're going in line with the artery. As that dries, I prepare my syringe. Okay. All right, Mr. Jones, on 3, I'm going to stick. And with my bevel up at a 45-degree angle, I'm going to puncture their skin. 1, 2, 3, big stick. And once I'm in the artery, it should allow for pulsation back so I can retrieve my sample of about 1 to 2 cc's. And after I've retrieved my sample, get my gauze over, come on out, and activate my safety. I want to apply pressure just to decrease the blood flow to the site and secure my bandage. After my bandage is secured, I want to take my sample and make sure there's no air bubbles in it. And if there was, I could flick it up and try to expel it. And then I want to roll to mix my sample. Okay, so we have our patient label, and what we want to make sure is that his name and date of birth, or her name and date of birth, is on there. Our signature is on there. The oxygen settings, so he's on a binasal cannula at 3 liters, his temperature, his SpO2. and we can put it in our biohazard bag. And because I am going straight to the lab, I will not need ice. But if you will not go to the lab within 10 to 15 minutes, you want to make sure you put your sample on some ice. When we're done, we want to make sure we reassess our patient. Just like before, get his vitals again and make sure he's comfortable. Mr. Jones, if you don't need anything else, we are all finished. You want to discard all your materials. Put anything in the sharps container that you have to. And you're good to go. So next I'm going to talk about some indications, complications, and contraindications of retrieving your ABG sample. Some indications would be if your patient has sudden and unexplained tachypnea or dyspnea, if your patient is cyanotic, or if your patient is on a ventilator and you do pertinent ventilator changes, you need to get an ABG right after. Some complications that can occur as a result of getting your ABG is a hematoma, or hemorrhaging, or even injury to the site of your puncture. Some contraindications to getting an ABG sample: if you don't have the collateral circulation from your modified Allen's test, you don't need to perform it. And also if your patient is on anticoagulant therapy, you don't need to perform an ABG. I hope this video was helpful. Have a good day, guys.